Welcome to Wellness Health Services Health Talks. My name is Dr. Joshua Derito, a family physician. So our talk today will dwell on chest pain. So chest pain is one of the commonest conditions that makes patients present to the healthcare seeking health attention. And even those who don't seek health attention, they are quite a number of people who suffer from chest pain for various causes. So there are different causes of chest pain. As you look at the chest, you move from the skin, the muscles, the ribs, then you have the lungs, and then you also have the heart in the chest. You have the part of the esophagus or the gullet, the tube that moves food from the mouth up to the stomach, and also you have the major vessels that move blood from the heart to the various parts of the body. So all these organs, any of them can be affected and they can have pain from those organs. So usually when you look at the skin, the commonest condition that can cause pain in the chest is herpes, or what present as shingles, and the pain is usually from the nerves and can be intense and can be very disturbing. Then you have the muscles and various conditions, especially after various inflammatory conditions, you can have pains from the musculoskeletal system. Then you have the lungs. The lungs can be affected by various conditions. There is a common condition that affects the covering of the lungs, and it will present with pleurisy. Pleurisy is a kind of pain that usually worsens with breathing in and breathing out. Then you can also have infections affecting the pleura, something we call pleuritis. Then from the pleura we move to the lungs, which is one of the major organs that occupies the lungs. And usually the lungs can be affected by various conditions, commonest being pneumonia. Then you can have pneumothorax, which is air in the lungs, and you can also have embolism or clots, which can affect the lungs, and this is a life-threatening condition where you have blood clots in the lungs. Then you have the heart, where there is the covering of the heart, and it can have pain from the covering, which we call pericarditis. And then you also have pain from the heart, and this is a life-threatening. And usually pain from the heart can present in various ways, and it is accompanied by other conditions like nausea and vomiting. You can have epigastric pains. You can have shortness of breath. You can have the pain from the heart can present with pain extending to the left shoulder, going to the left jaw, and it can extend even to the heart. And this is a life-threatening kind of pain, and you have a compression kind of feeling. You feel like you are having a lot of pressure, a lot of weight over your chest, and then you can also be diaphoretic, and you can also have extreme fatigue. And usually when this is the situation, then you need to seek for help as soon as possible. So when someone presents with chest pain in the healthcare system, the first thing is to make sure that they are breathing okay, make sure that their airway is okay, their circulation is okay. If they have any disabling condition, then you need to be taken care of. The main thing that can be life-threatening is if you have a pneumothorax or air in your chest, and this needs to be released immediately using a needle and then putting a chest tube. If you have a heart attack, then this is a life-threatening condition and it needs to be taken care of immediately. Embolism or clot in the lungs. This is also another life-threatening condition that can affect an individual, and usually the diagnosis is usually with a CT scan of the chest and what we call an angiogram. You can also have aortic dissection, which is, as I said, the aorta is one of the major vessels that moves blood from the heart to the general parts of the body, and usually this is also a life-threatening condition that needs to be taken care of and attended into immediately. So usually when you look at somebody with chest pain, as I've said, the first thing is you know what is the most likely organs that this pain is coming from. You rule out the possibility of life-threatening conditions. I have outlined some of the life-threatening conditions. And then there could be other pains from other organs, like you can have pain from the stomach. If you have something we call gastroesophageal reflux disease, it can present as chest pain, and this is usually treated with antacids, and it usually responds with the use of an antacid. You can also have pain from the pancreas, especially for people who take excessive alcohol. That can present with chest pain, and usually the pain is from the abdomen, but it is referred to the chest. So in summary, for someone who is presenting to the healthcare system, first of all, the health provider will need to make sure that your airway is okay. You need to be breathing okay, check your circulation. And then depending on what the health provider thinks is the source of the pain, you may have an electrocardiogram to look at how your heart is beating, and if there is any risk of a heart attack, which needs to be ruled out immediately. Then you can have a chest x-ray, and then you can have a blood count to see whether this is an infective process that is causing you to have the chest pain. And then once the life-threatening conditions have been ruled out and you are declared to be stable, then further investigations can be done. Most of the times, most of the chest pain is from the soft tissues in the chest, from the skin, the musculoskeletal system, the covering of the lungs, and they also can have referred pain from the stomach, from the gallbladder or the pancreas. And these are not threatening type of pain, but they need to be investigated and the appropriate treatment given. So in summary, when you have chest pain, the first thing, if it is chest pain that you feel like it is the worst pain of your chest that you have ever had in your life, you feel like there is an elephant sitting on your chest, and you feel diaphoretic and you are able not to breathe, then these are life-threatening pain, and you need to get to the healthcare as soon as possible. Other common causes of chest pain from the soft tissues, those ones can be investigated and the appropriate treatment given as necessary. So thank you very much for listening to me, and remember that the most important thing is to remember is this pain from the heart. And for you to think of pain from the heart, then there are risk factors like smoking, hypertension, diabetes. If you have any of those conditions and you have any chest pain, then seek health care as soon as possible. Thank you for watching. Thank you for listening to me.